Prynhawn da poib, and welcome to this meeting of the Healthcare Merthyr Tydfil Scrutiny Committee. Obviously, everyone who's online or as present know that this meeting is being recorded and will be broadcast via the authority's internet site. The images and sound recordings may be used for training purposes. So if we can move on to the agenda, item number 1. Any apologies, please?
Yep, we've had apologies from Councillor Claire Jones, Councillor Ian Thomas.
So Julie Jenkins.
Thank you.
Thank you, David. Item number 2, any declarations of interest? David?
Well, as I've previously mentioned, I'm a volunteer with Llais, so I'll have to declare an interest in that.
Is that just a personal interest or prejudicial interest?
It could be a prejudicial interest, Gar, because I go on site visits with them, and I am asked by Llais on occasion, because of my background, to take part in various and specific matters.
So, Councillor David Isaac, does that mean that you'll be taking yourself out to the meeting for that item?
I can take myself out of the meeting for that item.
Okay. And we wouldn't be correct, no.
It's nothing that I do go on special meetings. There's nothing if we're not voting on anything and I can't add anything to it. It's not what should I say? I'm not prejudicial in any view towards the company. It's just that I work with them on occasion, that's all.
As a volunteer?
Yes. I don't get paid by them, I just volunteer.
I think Daniel's happy for him to remain meeting.
Yeah. So we don't note that.
Daniel, would you have any view on that, please?
Yeah, of course, Chair. I'm more than happy for David to maintain. He is just a volunteer capacity. In previous days, the CHC, there might have been a conflict of interest, but not as Llais now.
Yeah. Thanks, Dan. I haven't seen him for a while.
Thank you very much, Daniel. Councillor David Hughes.
Yeah. Please, Chair, can I, item 6, SGO, I have a personal and prejudicial interest in it.
Okay, thank you, David. And you'll be leaving the meeting?
I will be, yes. Thank you.
So we may have to consider our course of action when we come to that item on the agenda by the sound of things, because of numbers who are here today.
What I would suggest is leaving that until the last item on the agenda, because as soon as Councillor Hughes leaves the meeting, then we're not correct.
Yeah, but Councillor Hughes come back into the meeting then straight away, can't he?
We'd still only have 2 then, you see. If
Councillor Hughes leaves for that item,
yeah,
we've got to say that item can't be taken. Then we move on to the next item then, which Councillor Hughes will be in.
We did. And I thought what was agreed is that you were going to pull that item for the 24th of March meeting, the SGOs.
Yeah.
Yeah?
Yeah, so it's going to be pulled.
Yeah.
Unless anyone surprisingly joins us at some point,
yeah,
it'll be pulled, but we haven't got to move any items on the agenda. We can still follow the agenda as written.
Okay.
Yeah. Okay. So item number 3 are the minutes of our meeting held on the 6th of January. Have members present had an opportunity to look through them?
I'd like to move them, I would.
Thank you, Councillor Hughes. I'm just checking now. I'd rather it come from the floor if you were present, Councillor Isaac. Yeah. You were present, I believe.
Yeah.
Okay. It's only approving for accuracy, so that's carried, Jane, okay?
Okay.
Item number 4 are action logs, and I think all actions from the previous meeting have been actioned, so there are no outstanding matters to discuss with regards to item number 4. So moving on now to item number 5, which is the Llais report. Louise, are you taking us through that initially, and then we'll bring Daniel in as required?
I'm happy to, if Dan's happy to.
Can I, just before you start, Louise, can I ask now, am I going to remove myself so we stay correct, or do you want?
I think you can just not take part in
the
the
conversation,
debate.
yeah,
That's fine.
I'm happy to do that.
Yeah. It's an information report,
Yeah, it is,
really, anyway, isn't it?
Yeah.
Councillor Hughes has got a different role in his when we come on to his item than just being a volunteer, etc. We can't go into any more than that, but he has recognised that. Okay, so Louise, you going to introduce that, please?
Yeah, I'll give a quick overview. So this report provides an update on Llais, the national independent citizen voice created to ensure the people of Wales have a stronger say in the planning and delivery of health and social care services. Its core functions are to engage in communities and represent what people tell them to providers and offer complaints and advocacy service. So Scrutiny has requested this local Merthyr lens following the presentation to full council. And the purpose is for members to discuss and note the content. Llais held a public event at Merthyr College on the 21st of October 2025, jointly with the Health Board and the local authority, to share priorities and hear directly from local people, particularly students on health and social care courses. There's 2 appendices included for clarity. On how Llais expects to be engaged in service change. Appendix 1 was the protocol, and that sets out statutory expectations. And Appendix 2 is the framework providing an assessment matrix. And the recommendations of the report is for the content of the report to be discussed and noted. Thanks, Chair.
Thank you, Louise. Daniel, would you like to add anything to that at this point, please?
Just 2 points of accuracy, or a point of accuracy and a point of clarity, if that's okay, Chair. So the event referenced was in 2024, not 2025, in the college. And then from the service change issues, it was really helpful to have a joint meeting with Lisa and also the Directors of Social Services of Bridgend and Rhondda and Taff, where we discussed some concerns in our documentation that has since been taken back to our executive team, been raised in discussions with ADSS Cymru, and there are developments underway to make them more palatable for local authority, because there was a heavy health influence in the initial design. So that's been taken back, and I think what I would say in summary, that the CHC's had a great history in health. We're still only 3 years into being as Llais as a health and social care organisation. We're still learning social care, and I'm very grateful for the opportunity to be here today as well.
Okay, thanks, Dan. Thanks very much. Any questions of members, please?
I thought I asked that question being you come here, Dan. On the assessment matrix for service 3.2, it says that 3.41 is extensive involvement in high priority changes. Can I ask, with the removal of a stroke unit up in Merthyr, what was your involvement in that?
I think if I was given the opportunity to summarise some of the concerns being heard from a Merthyr perspective, stroke services would have been one of those. So yeah, welcome the question. In relation to the summary of engagement options there, just for clarity again, that is health specific in its focus. So that's one of those things being worked on from a local authority perspective. Just get that in because there was opportunity to do so. From the stroke service perspective overall, our involvement in the initial stages was essentially being informed that the change would happen because it was done under the urgent and temporary change arrangement. Now, where the health boards say it's in the interest of public safety, patient safety, we don't actually have the remit to push them through an engagement and consultation process. When that was initially put in place, it was 6 months, I think, was the initial assessment. So it'd been for 6 months. We've been asking questions near enough on a monthly basis for updates around performance and what will be going on. We're constantly assured that there is emergency treatment available in terms of the thrombolytic care given within the first 4 hours in each of the emergency departments, but then ongoing care, as you know, is in Royal Glamorgan Hospital. So constantly asking questions, and my position is linked to this document as you've seen, and it is Welsh Government guidance, that the stroke service, although it's currently an urgent and temporary change, and I can't force them to return that on a patient safety basis because that's what they've said, it should be made very clear that the health board cannot make that change permanent without going through a formal engagement and consultation process. So they've got two options. They can either return to the service as was, to the status quo previously, and not only is that Prince Charles in Merthyr, but also Princess of Wales in Bridgend, because the services were moved out of there to Royal Glam as a result of the roof repairs. Now, if they don't do the status quo arrangement, they don't put it back, they have to engage and consult the public across CTM. So a complete public consultation across the entire geographical area, and that has to take place from the moment that they recognise that they don't intend to put it back. Now, whoever works on this matter within the health board will have their own opinions on that. If, as they're saying to me, they're seeing performance improve and they're seeing that this change of service is a positive, and I make no judgment on that, and I appreciate everyone can make their own judgments, but if they are telling me that that's their direction of travel, to me it implies that they've made their decision that that is where they want the service to remain in the longer term, and that triggers the requirement for engagement and consultation. So that is what I've been advocating for the last, I think, 6 months.
6 months, yeah.
What I should add on to that as well, it was an initial 6-month period for the urgent temporary relocation. They've extended that to a year because they've said the size of the change needed more information, more data to demonstrate how it's improving, what the issues are. So that takes us to the end of March this year. As of the 1st of April, I would expect an outline position from them as to how they take this change, this service change, comes under that guidance forward.
Right. Thank you for that, and obviously you are well aware of it. Having been a member of a CHC before, I was often a critical friend, and I find that how have you found since you've taken over? Is there enough challenge, do you think, done by Slice? Because obviously I haven't heard much over the last year or so, but when I was in CHC, I used to go up and do visits up there and sit there for days, speak to parents and carers. Well, I think David said something before the meeting started, so it is happening now. So I didn't realise that was happening, but I haven't spoken before the meeting. It is happening. The only other one thing I would say is that, as you rightly pointed out, it's only 3 years since you started, and social services is a new part of it. How do you feel that is going? Is it too big a remit, or do you think you could have a bigger team to do this work? Because social services is a massive portfolio on its own, and health is massive also. And I think how many you've got in the team? I was looking, you haven't got that many in your team. You've got vacancies there. So do you think you need more people to do a robust challenge? Because obviously, you know, the political view of the NHS at the moment is very high on the agenda. So do you think you need more staff to be able to challenge and to get the best out of both social services and health?
Definitely keep me on my toes with those questions. So thank you for them. So in regards to the challenge, I'll start with that one. I think we're still developing now as Llais from the CHC. I speak with the utmost respect for the volunteers and former members, but when we were the CHC, our members had to make judgments on what they were seeing and hearing from the public and what was presented to them. I think with the challenge now, it's very factual based. So wherever it is that's represented to me from the public, I'm able to essentially represent that to service providers. I think the shortcoming in that is that I can't fill a void of information with the members' considerations as I would have in the past. So where I don't hear stuff from the public, I don't then have the remit to make those representations and that challenge, because it shouldn't be essentially, because it's staff driven now, it would be my own assessment. I don't think that's fair or appropriate to do so. It has to come from an evidence base. In regards to the 3 years, I'll be honest, although there are a national board members and executive members who will take other considerations to me, I think I've said this in numerous fora. I probably did in the presentation I delivered to council a number of years ago. The more people I have on the ground, the more coverage I can provide. So I think we would always need more staff. We like to fill that gap with volunteers, of which David Isaac is one, and you used to be one yourself. So the more volunteers I have, the more that they can cover health and social care services. I think in regards to social care, I'll talk from an advocacy and a visiting perspective. In advocacy, when we have a health matter, it's very much a transactional nature. They come in, something goes wrong, it has a negative impact on the patient, they're able to complain. When people want to complain to us, or so we've learned about social care services, it's about the long-term impact on their case. You've actually got to unpick everything that's been going on, so then it makes it harder to determine whether it's in remit or not. So I think our assessment is roughly for every 3 health cases, social care is 1. From a capacity perspective and a demand on that time, not necessarily the amount of cases we've got, because social care is still really, really low. From a visiting perspective, we are still very much new, because we don't know what it is we're looking for that's out of the ordinary in health. You know when something's out of place, you know when something's not been sanitised, or likewise in a clinical setting, you can point to these things. Social care, we've got to learn that, and that's why we try to do the first few visits in partnership with the local authority. But what I'm also very conscious of, and I'm very grateful to Lisa and her colleagues for affording me the time to have discussions on a regular basis, is that we need to know what processes we want to follow or need to follow to get the right results. So we've just done a care home visit today in Bridgend. Now, if that was health, I would just send a report in through well-established processes. What I'm conscious of in local authority, that's still very much new and can cause some anxieties within the teams as well. So I think the approach we'll take from a local authority perspective is I'll hold a meeting with the responsible person, the assistant director or heads of or managers of services, talk through some of the issues we found and do it on a meeting basis that'll be a follow-up. So yeah, 3 years, I think we're still in our infancy from a social care perspective. I think we've got to learn. And I think actually taking that slow learning approach, apart from when there are urgent issues, we would react quite quickly. So if something came up in Merthyr, please rest assured I would reach out to Lisa to speak to her on an urgent basis. I think taking a slow approach is the best way. I don't think you need a sledgehammer to crack a nut type approach. So yeah, I think still a long way to go to learn. We've got to get there very quickly, and I think the best way to do that is in partnership. So I took note of the chair's starting point that these meetings are broadcast via the internet, and I know you've got some matters coming up over the next 2 meetings I'm interested in. So I'd be looking to observe those meetings moving forward as well, so I can learn myself.
Thank you, Dan. Any further questions, Councillor Hughes?
Well, I got observation. I wouldn't say question.
A comment, is there? Yeah.
Yes.
Yeah. Okay. Thank you, David. I've got just a couple, Dan. Really, you've got the report there in front of you. I'm assuming it's not just your appendices. It's in relation to the the event at paragraph 5.1, which took place at Merthyr College.
Yeah.
Was that a publicly advertised event? Because I'm unclear from the report whether it was only restricted to students in the college.
Yeah, no, yeah, publicly advertised, but I believe the attendance was circa 20 people, and 18 of them were individuals from the college. There were 2 members of the public who turned up from the learning disabilities groups in the area as well.
Yeah,
but
is
no
that
no wider public attended.
Right, yeah. Because I was concerned that it was only for the college itself, you see. But obviously you've clarified that now. It was only the students who, in effect, had turned up, or in the main turned up. And then my other question is in relation to the various paragraphs at 5.2 to 5.4. Which outlines the protocol between Llais and the with regards to service change and engagement. Can you give any specific examples where you have engaged with social services in relation to those paragraphs, please?
In regards to service change, there's no current examples where we've been actively involved. There are, as I alluded to with Councillor Hughes, the stroke matter in health, and there are more in health. What I found helpful is when I do have discussions with Lisa, Neil Elliott, or Clay Marchant in Bridgend, we discuss some of the changes that are coming, but we've not actively been involved in any of the service changes from a local authority perspective as yet.
Yes. Okay, thank you for that. That's all the questions I have. Any comments, please? David, you had a comment or an observation?
Yeah. Observation. I've been I done a survey on the offices at CHC on times it takes the phone to doctors, surgeries, and I done a survey through Aberdare and Merthyr. And to be honest, the difference now, my observation is, when I'm ringing now, it's totally different what it was even 4 years ago, because you can't get answered at all, to be honest. You might be 34 on the waiting list and you get the one and the phone goes off. So that my observation is that whereas you could challenge it before, I don't know whether the volunteers are able to challenge that now, you know what I mean?
Yeah, of course. Chair, happy to respond to that one, if that's okay.
Yes, yeah, fine.
So again, I think you read it from my list, Councillor Hughes. Stroke was number 1, GP is number 2. Just for interest, number 3 was dentists, and number 4 was Prince Charles concerns in the wider main, and that was about emergency department in particular, as well as other matters. From a GP perspective, yes, we can challenge, but going back to my earlier point in regards to the challenges we can make, I can only do so when I hear from the public that they have those issues. So what I would advocate is that you put as many people in touch with my organisation, whether it be through volunteers such as iachach, or direct to our telephone numbers and our email address, so that we can build up that critical evidence base and we can make that challenge. I've got some examples where we've done that with some practices they're in the Rhondda Strand, but Forestview Medical Centre, Tydfil practice. As long as I've got those matters coming in, we can make challenge. But although I know they're there, I can't use my own knowledge as a springboard to make that challenge.
Thank you, Dan.
Basically, David, we need to get the word out really for the public to contact Daniel's organisation, don't we?
Yeah, I think so.
Yeah, but it's good to hear him saying that, and thank you for that, Dan. You know,
Excellent.
So Chair, if I could follow up on that point, if that's okay.
Yes, certainly.
I want to put it on record. I've said it once, but I will reiterate. I think the only way the public can truly have trust in us as an organisation is if we are truly representing their voice. And that's why we're called Llais. It's the Welsh identity. It is the Welsh voice. It shouldn't be for me or anyone sitting in my seat to make those representations. It has to come from the general public. And just if I could make you aware, I know I'm taking up your time, I apologise. we're doing a piece of work shortly on children and young people's experience of children and adolescent mental health services and neurodevelopmental services. We've got an event that we're organising on the 30th of March where we're hoping to involve the youth mayor, both incoming youth mayor and the outgoing youth mayor at the end of March, so that we can hear directly from those people experiencing those services. So we've got that coming up, and another focus that we're looking on going into next year is childhood obesity and the support wrapped around families in the Merthyr area as well, particularly Dowlais and Pendarren. So I just wanted to make you aware of those coming up in Merthyr.
Thank you, Dan. And thank you for attending. Yeah. And thank you for attending today. I think this is, as a committee, we'll be perhaps looking to include you as an annual item on our agendas, but that'll be a matter for the committee to decide, really. But it's been very, very useful you attending, and thank you very much.
Thank you, Chair. I would welcome future attendance, and in future I'm hoping that we can construct something internally so I can bring you some very relevant Merthyr data. At the moment our systems don't allow me to pull complaints in that way, but I will endeavour to give you something more pertinent in future as well.
Excellent. Thank you very much. Before we move on then to the next item, members have to decide, well, David and myself I suppose, and have to decide that we've looked into the report which has been presented to us, and have added value. Well, I think we've had some very interesting comments made there.
Yeah, I learned something new for definite.
Yeah.
Thank you.
Okay, thank you very much. So we can move on to item number 6. I think Councillor Hughes is making will be declaring an interest, as he's indicated already. So unfortunately our committee now is in quorum, and this item will now have to be moved on special guardianship to the next available committee. It doesn't mean it's going to be on the next. We've got to look at agendas, really, then that fit appropriately within the agenda. We don't want to cram it too full, that we're not going to give it justice then, really, when we come to decide it. Okay, so we move on to item number 7, which is the Vale, Valleys and Cardiff Annual Adoption Report. Louise? And I think we have been joined by Angela Harris from the Vale.
Yeah, I was going to say I'm happy just to hand straight over to Angela.
Okay, thank you very much. I think members have all adopted. David, you raised your hand?
Yeah, very much similar to the Clois report, because I have been on the panel of the adoption panel as well.
But is it influencing?
It's not influencing my decisions at all.
We're just receiving the report, the annual report.
It won't influence my decision.
But there's no decision really. We're just noting the report in effect, really, isn't it?
Yeah. Okay. Yeah. I just wanted you to know. That's all.
Yes. Okay. Thank you, David. Yeah. We've all had the opportunity of reading the report, Angela. But if you'd like to take us through some of the pertinent parts of it, please.
Yes. Okay. Thank you. This report covers the reporting period ending on the 31st of March in 2025. It is our annual report, and it's part of our collaborative working agreement that we actually report on an annual basis to scrutiny committees. So that it sort of follows a similar format to previous reports that you may have recall. And it's obviously we're also under regulation required to report on our quality of care reports, which are called Reg 39 reports. So the findings of those reports are incorporated in the overall report.
Yeah.
Attached to the report, there are a series of appendices covering our main functions: family finding, recruitment assessment, adoption support, adoption panel activity, and we've included a new one this year in terms of quality assurance. We have developed a relationship with the Vale's QA department, so they've begun to
collate the findings, really, the feedback from the various surveys that we carry out of users at various points in their journey, really. So in terms of the governance of the region, that's remained the same. We've got a joint committee that meets twice yearly. During this period, we had an extraordinary meeting in the January because I think we're now we're having to do that year on year because we need to decide upon the budget for the the forthcoming year. So so those meetings, and I think we've been commended on that structure by the National Adoption Service because it meets regulatory requirements, and we actually are unique in Wales in having that strong joint committee. So that is a positive. We've recently undergone an inspection by CIW, and that report we've had the draft report, but that has not yet been finalised, but will hopefully be due out in March, and that report, the draft report, does highlight our structure. I mean, obviously underneath that we've got the operational group and the management board, which meet on a quarterly basis, and again all the terms of reference of those levels of governance are covered in our agreement. We are subject to annual financial audit, and during this period the audit report was published and we had substantial assurance. We also revised our WASPI, so our information sharing agreement between the 4 partners, so that was also finalised during this reporting period. As part of the National Adoption Service, we are required to report on a range of performance factors and indicators on a quarterly basis, and they have substantially increased really since the inception of the region and NAS, really, and we report about 68 performance measures every quarter. So it's quite a large area of work really for the collaborative. In terms of we've become quite a large service. The year before this reporting period, as part of the cost savings, we did actually lose 1.5 social work posts. So during this period, we had to obviously monitor the impact of those loss of posts on service delivery. Fortunately, we didn't have any savings to find this current financial year, but I think we've also during the year been actually looking ahead and looking at what perhaps savings we can make by developing an early help offer for families in need of support. So in terms of the appendices cover, as I said, the 4, the 3 main service areas, and I suppose obviously the big area of activity is family finding. So the appendices obviously covers the all the areas that we have to monitor. I think in terms of this period, we've seen a gradual rise in referrals, children requiring adopted placements, and that has not diminished this current reporting year really. Obviously the reports look at a 3-year, we try and do a 3-year comparative reporting, so we can see the trends, and obviously it highlights the figures for each partner authority. I mean, in terms of obviously, I think you probably see from the figures that Merthyr figures are significantly lower than the rest of the region. But in terms of obviously what we even though we report individually, we also report as a regional performance, really. So it's, so we look at the total. I think in terms of, so I think children's activity, it was up, and during the year we actually placed 50 children so that is increasing. I mean, when we were first established, we were in the sort of 80s and 90s, but obviously, with alternative means of securing a permanent future for children, then that obviously has an impact on adoption. We've seen quite a significant trend in terms of very young children. I mean, 64% of the children were actually under 1, which is quite a significant factor, I think. And almost half part of the sibling group, which I think we found is, sometimes challenging in terms of securing placements. We've obviously, there's been a huge investment in life journey work as a result of the grant funded posts, and our performance overall, I think, has definitely improved as a result of those posts, although we do sometimes have some delays with the provision of the later life letters at the second adoption review. We within the service have got some grant funded posts ourselves, and we've got a transitions worker, and we've got life journey work coordinator, so we're able to utilize those posts to carry out some of the good practice initiatives that have emanated from NAS, from the National Adoption Service. Although some of those new ways of working we can only put in place for children 3+ because of resourcing. We continue to, we undertake a range of family finding methods, and we're always, even though the emphasis is on trying to place children in Wales, if it's necessary and we haven't got a placement within Wales, then we will obviously seek placements externally. So we're because obviously we have to monitor children waiting and the length of time children wait. We're monitored on that. We've been quite we certainly we are the lead region in terms of Welsh Early Permanence, which was the sort of new development really a few years ago, which enables a child to be placed initially on a fostering basis and then an adoptive placement if the plan remains permanency, to obviously avoid those moves for a child. So we're actually the highest performing region in Wales in terms of WEP. During this period we had actually 3 disruptions. We're again monitoring the numbers of placements that have been disrupted, sadly, and we've actually did undertake, one of the managers in the service actually did undertake a thematic review of those disruptions over a 10-year period to see if there are common threads and common messages and common, because obviously we wherever possible we want to try and prevent those things happening because obviously the impact on children. In terms of recruitment and assessment, this is probably one of the big areas of concern now for our region, and it's a national problem because historically we've always produced quite a large number of adopters, but certainly during this period we started to see the dip in those that go on to be approved, and that is now part of a national it's a national issue. There are insufficient numbers of people coming forward and then going on to want to be approved as adopters. And we're actually, so in terms of our, it's the conversion rate. We do we have quite a significant number of inquiries, over kind of 200 during this period, but those that then go on to actually convert into applications and approval, is significantly lower. So we actually only approved 44 during the period, which is, probably, and sadly this year I've been looking at the Q3 position, where we're at in terms of this financial year, is that is trend has continued to sadly decrease. So we're trying to, and in terms of Merthyr itself, we've done quite a bit in terms of direct promotion of adoption. We've got quite strong links. Our marketing officer's got strong links with the comms department in Merthyr, and we last, in this reporting period, we actually utilised the council tax inserts. More recently, we've had a stall up in Trago Mills, and we were due to attend Merthyr Pride last year, but that was cancelled. I understand we're scheduled this year, so we're trying every which way to sort of obviously increase that activity in terms of Merthyr itself, really, because obviously if possible, but I mean, we're still managing to place quite a significant number of children regionally, which obviously for those children is better, although that, I think it was 62% across the board during this period, although we that is I think again on the decrease, sadly, which means that we have to rely on more external placements, which actually incur costs to local authorities. In terms of adoption support, over recent years, we've continued to see this as a growth area. The adoption service nationally has done certainly a lot to promote the whole adoption support agenda, and it is actually from when the region was first developed back in 2015. I mean, that it's been a huge growth area. But I think what we've identified, certainly within our region, which is which our management board and joint committee are aware of, is that the resourcing of that agenda and those expectations is posing challenges, really, both on LA budgets and our own resource. Because we're now required under the performance management framework to actually monitor the number of unallocated requests for post-adoption support services that we have at any one time, and also those that wait over 4 months per service. So those are the and we've also seen quite a significant increase in persons coming back to us to access their birth records, and then some go on to request intermediary support, where we actually facilitate contact with birth family members post adoption. Having said that, I think adoption support has actually developed quite a different range of support services. We run the family hub for adoptive families. We have a twice yearly fun days. We run a sports club for some young people, and we recently developed a birth parent support group, and we have strong links with class in terms of if children require therapeutic packages. So there's a lot of supports in place, but it is an area that is is increasing significantly. In terms of we're also the report will you see details on sort of policies and procedures, details on complaints. We have quite a low, fortunately, a low level of complaints, but we report on those in this report. And obviously our adoption panel activity is one of the dependencies. We operate the joint adoption panel across the region, and we have 4 sit-ins scheduled a month. So so that gives you some idea of the workload there. But those are the do you want me to sort of we also obviously there's some national grant funded projects, Pathways project. We have a Pathways coordinator that's facilitated by Adoption UK, and that worker then for some families they are have an assessment of post-adoption support needs, and then they're referred to Pathways. Similarly, Adoption UK run a connected service for adopted children and young people 7+, and we have a worker who participates in that on a monthly basis. So on a Saturday it is, those groups run. So so I can go on with
Thank you very much, Angela. That was very comprehensive, and I'm sure cut out a lot of our questions now as well, really, because you've answered them. Any questions, please, for members? No questions, David?
Yeah, I got this.
Yeah. David Hughes, please.
Yeah, I got some questions. The length of the report was long, to be honest with you. When you read all the information you sent us, it took ages to read, to be honest with you. And I must commend the information you give was excellent, to be honest with you.
Thank you.
As you described throughout what you just told us. One of the things that I've been about the breakdowns.
Yeah.
I got my own theory where I think some adoptions break down, but as you said, you looking at trends.
Yes.
What are the trends? What do you feel are the trends?
The trends.
Your opinion.
Yeah, and I suppose the 2 major things that arise are, I think, probably significantly the range of difficulties that children often present. I think we know a lot more now about early trauma and the effect that has on development. And the other one, I think, is around what's emerging really is general expectations of adopters. I think they're, even though we provide, quite a lot of intensive training, we run a 3-day preparation course with Western Bay. There's a follow-up course, a 4th day, and they have a session on life journey work. I think sometimes the actual reality of caring for it's very difficult to actually, train people in that really. So I think we're seeing, sadly we had a disruption yesterday, and the feedback was, having cared for the child for a couple of weeks, they decided they didn't feel able to be parents. It's quite stark really after going through that whole process. And it's so I think we're seeing those sort of themes arise certainly around complexity and the needs of the child, but also sometimes the expectations of adopters. It's not what they thought they were going into, But and I think NAS are interested in the whole area of disruption. So even though we've done a 10-year review, NAS have just recently commissioned, we've had to do a 3-year study. So that information has been collated across Wales. So there will be some report coming out of that to see if these trends or themes, and obviously across Wales, and we need to learn lessons from that to see, is there anything more we can do really to actually avoid these, because they are, they can be very distressing for everybody concerned, and very distressing for, the workers and, obviously the child, I mean, so.
Yeah,
that answers
one
it.
of the things I was going to ask is that you training, you obviously you mentioned training in the conversation, it's written in the report. What times do you do the training? Because
we operate the face-to-face training over a weekend and a Monday.
Yeah.
So it's a Saturday, Sunday, and a Monday. So I mean, when we get an inquiry, we offer an initial visit. So they meet with the marketing officer or a social worker. And then there's an information evening. This is before the formal training, more formal training. So there's quite a bit of, and obviously we recommend, as part of now the new way of working, we recommend a lot of reading, a lot of prep that we expect the adopters to do, and it's, that is then discussed as part of the assessment with the assessing social worker on the couple or the single person or whatever. So there's quite a lot of preparation. It's not something, I mean, we are required to approve within 6 months, and we're quite good at meeting time scales. But if things need to be extended for whatever reason, then we would do it, because obviously we want to try and get it, as right as possible.
Yeah. With the training, I find that that puts off a lot of people.
Yes.
From past experience.
Yes, you can.
I can say that you only got certain time to lives are so busy these days. When you expect it and give up weekend training, that can sometimes be hindrance into.
Well, that's right, and that's why that expectation is spelled out too. But we only offer the formal training after somebody is registered. They call it, it's not applications now, it's registration of interest. So that triggers in the stage 1 process. But yeah, you're right. Yes, it can put people off, really. Yeah.
Okay, David?
Okay. Yeah, that's been done. Thank you, Gareth.
Thank you very much.
Thank you.
Okay, we haven't finished yet, Angela. I've got maybe I've got a couple. David, are you going to ask any questions or not?
No, thanks, Gar. I seem to know a lot of it, but
yeah.
Okay.
Thanks. And it was a bit remiss of me before asking members for questions to ask if you, Joanne or Lisa, wanted to say anything on the report.
No.
No. Okay.
And the only thing I was going to say at the end, but I'll say it now as you've asked. This is Angela's last scrutiny with us, because she's made the difficult decision that she's going to retire. So
before you
to highlight that.
Oh gosh, thank you for reminding me.
I haven't asked my questions, have I? But Angela, we'll give you a fond farewell at the very end, okay? I've got only a couple of questions, because you've gone through it quite comprehensively, really. This is a bit ironic, really, I'm asking this, but in the actual report, there was, I think at paragraph 2.6, there was an issue, and I'm a bit embarrassed to ask the question, there was an issue about quorums in an operational group meetings, that you only were able to meet.
Yeah, we had a problem with quoracy that year.
Yes.
So because we are, so that was acknowledged, and it was highlighted by the auditor. So we actually, the audit is not just financial. It is it's governance as well. So we highlighted that, and touch wood, this year we're compliant.
Yeah, perhaps Andrew didn't understand what I was saying.
It's just,
No,
it's a
no.
quality issue.
Yeah, but no, we have just been, we are struggling with quorums here today, Andrew.
I know.
That's what I'm saying, yes. Really speaking, it's just a, yes or no answer, really. How do you feel you are? Do you feel you have sufficient staff at the moment to
At the
cover all
moment, I
functions?
mean, we just had we had an extraordinary joint committee last week, and we were obviously the agreement was that we wouldn't sustain any further. We didn't need to savings this year, any cuts really. So at the moment, yes, and obviously, I mean, it was quite a big hit losing 1.5 posts from recruitment and assessment. So I wouldn't want to, take a further reduction particularly because children's activities going up, and we need the staff to we need to be able to recruit more adopters. And it's more cost effective in the long run if we can actually recruit internally adopters rather than rely on external placements.
That's right.
So, so at the moment, yes. I mean, I think we've got challenges in adoption support, but we are looking to see if, with our partners, some of that adoption support work can be picked up at an earlier point by, early help services in the partners. So that will obviously longer term will reduce the demand on the adoption support team, which is quite small.
Yeah.
So, it's, I think, I mean, we do have a challenge in and again, we're not on our own. When in 2019, Welsh Government gave us a grant, they've all, NAS and all the regions grant funded posts. But the problem is that there's been no uplift since 2019, even though representations have been made to Welsh Government. So, being able to sustain those posts year on year has created an overspend in the core budget.
Yeah.
But it's outside our control. But those posts have been, very crucial in trying to develop new ways of working, and certainly, and this issue is applied to our local authority partners where the life journey workers are located. So that is a challenge in terms of staffing.
Thank you, Angela. I've got no further questions. I think Councillor Hughes having a second bite of the cherry, as they say.
I just one thought. I'd like to ask, not Angela, leave Angela off. It's Lisa and Joe I want to ask a question to. I know they might be a bit young to think back so far. Going back to when we had our own adoption service, when it was in-house rather than being a regional adoption service. Do you think it was better then, or do you think the new service being regional is a better service? You want to put on the spot? I know you're young.
That's an honour.
I think it's difficult to compare. I mean, obviously we used to have a fostering and adoption team, so it was different because they did fostering and adoption. I think being regional gives us the opportunity that within that patch of 4 local authorities that is still classed as placing in-house. So we could place a child in Cardiff, for example, or the Vale. So it opens up your opportunities. So in that respect, I think it's much better. I think, there's issues both ways really, and a lot of it is like Angela's described some of the barriers where placements break down. We're not getting as many adopters coming through the doors. IVF, health things have improved. Yeah. So people are going down different health routes. I think that's probably the difference. We probably had more adopters to choose from years ago than we do now because people, they decide they want their own baby. Yeah. And, I mean, as it is at the minute, we're having lots of babies coming through. And sometimes people don't want to adopt the older children because they see that perhaps they are the ones who are going to have the issues, perhaps, in the longer term. And, sometimes they do come with, additional needs or they've got, family ties, they still have contact. and some people don't want to take that forward. They'd rather have a child who doesn't still have that contact with family.
Yeah.
Okay.
Thank you for that. Thank you.
Any comments, please? Okay. Well, thank you very much, Angela,
Okay.
for your very comprehensive report, and all
Thank
the very
you.
best for the future.
Thank you very much.
Don't just go just yet, in case there are any questions, any more questions raising. We've got to discuss now whether we feel that we've looked at this report in sufficient depth. Obviously, there's only been 3 of us here. David, what are your feelings? Are both Davids on this?
I think it's been very thorough. Yeah. I was quite impressed with the reports, and I think it's a good one.
Yeah. Professor David Hughes?
Yeah, I thought Angela, I honestly told us everything in that report. I read that report. It was an interesting report. There was such detail in it, to be honest with you. It was, well, I thought it was well.
Yeah.
And I thought the questions were pertinent, so I think we done well.
Yeah, I think we have, yes. And thank you, Angela. You added more meat to the bone in many respects, really. You filled in a lot of the gaps.
Thank you very much.
The more detail. But all the very best for the future.
Thank you. Appreciate that. Thank you.
Thanks a lot.
Thank you.
Thank you.
Bye-bye. Bye. Thanks.
Okay.
Bye.
Moving on then to item number 8. It's our forward work programme. I think, where I've lost my space here now. Here we are. Obviously, Jane, we are working through this as recommended, although we have got a little glitch now as a result of the one report being pulled, but we'll have to look where will be the best place to slot that into it, if we want to do it today or...
We can do that after the meeting. I'll speak to Lee.
Yes.
That's okay.
Okay, yeah. Because we don't want to overload then in the next meeting. If it can slot, perhaps, are you in agreement that we look at it where the best to slot the special guardianship report in? Okay.
Yeah, I'm all right with that, guy.
Yeah. Item number 9 then, scrutiny referrals. We haven't got any. And feedback on scrutiny activities. There aren't any. And there are no any, item 11, there are no any items of any other business, so it leaves me now to conclude and close the meeting, and wish you all a very pleasant evening, and thanks for your attendance today. Much appreciated. Okay, thank you.
Thank you.
Thank you.